page. Today we are going to discuss pyloric stenosis. Pyloric stenosis is a condition whereby the pylorus, that is the part of the stomach that joins the small intestines, become extremely narrowed, preventing food from moving from the stomach to the small intestines. When this happens, there is a buildup of food content in the stomach, and the stomach tries to push this food forcefully into the small intestines, and this leads to the signs and symptoms such as projectile vomiting. The baby's vomitus can go a few inches away, and it's usually forceful. That is why it's described as projectile vomiting. And there is also a palpable olive-shaped mass in the abdomen, upper right quadrant, and persistent hunger. This food is not able to move from the stomach to the intestines, hence there is no absorption of nutrients for this baby. And because of that, the baby's body persistently requires food. She has the urge to eat, so the baby continuously cries for food. But anytime they take the food, they end up vomiting it out. And because of the persistent vomiting, there is a likelihood of dehydration. So most of these babies present signs and symptoms of dehydration. And weight problems. Food is not able to go down to the small intestine for absorption. If the child was already having a weight, they are going to lose weight. And then they are not able to also gain weight subsequently. So they usually have weight problems. Now, we learned that the stomach tries to contract and push the food down. So there is usually this wave-like contraction in the upper abdomen, moving from one side to another side. How is this condition diagnosed? These are some of the diagnoses. An X-ray can be done, an ultrasound of the abdomen can be done, and then the physical signs and symptoms or examination can also be used to confirm them, which is the dehydration, projectile vomiting, palpable olive-shaped mass, persistent hunger, and then some electrolyte imbalances due to the dehydration. Treatment of this condition is purely surgical, and it's a nursing management, of course. The surgical treatment is pyloromyotomy. Pyloric, myo, muscles, tomy, open. So the muscles of the pylorus is open from outside to release the pressure, and when this happens, the food is able to move down. Pre-operatively, as a nurse, these are some of your duties. Vital signs is very important. You have to monitor vital signs, pre-operative vital signs for your client. Ensure that the patient or the baby is well hydrated. So you administer prescribed IV fluid, and then the stomach has to be decompressed. You have to pass an NG to remove the content of the stomach so that it will not interfere with operation later on, leading to aspirations. Meal per hours. The baby's mother is advised not to feed the baby, especially after the stomach decompression, for some few hours to operation. And then you have to give emotional support to the parent, which is very important and significant. Post-operatively, fluid management will continue post-operatively, and pain management is also to continue. Pain management, prescribed pain drugs can be given, and also educate the mother on how to handle the baby to reduce pain. And wound care, you have to assess the wound for signs of infection, that is 3 days post-op. You have to assess the wound for bleeding, and then feeding. Feeding may continue about some 8 to 12 hours post-operatively, and the feeding usually starts with small, frequent light meals to the form.